Welcome, viewers, to a great platform of scientific data diffusion, Dr. K.K. Agrawal's Med Talk. Today is the episode number 353, a Med Talk in collaboration with IJCP, Heart Care Foundation of India, and USV. Today we have got an interesting topic. When we think about wall of cricket, only one person's name comes in our mind. Similarly, when we talk about a versatile antibiotic, doxycycline comes in our mind. In the previous episodes, we have looked for various properties of doxycycline, maybe an antibiotic effect, anti-inflammatory effect. And today we are going to touch upon further different aspects like malaria, leptospirosis, dengue fever. And for this particular talk, we have got a versatile doctor from Delhi, a great physician, Dr. R.M. Chabra. He has got extensive practice in OPD, medical wards, as well as intensive care unit. He have got so many foreign degrees with him, FIMSA, FICP, FDI, FRCP. And I think he is from a city of Delhi, like Dilwale Delhi. So I request Dr. R.M. Chabra, he will present some beautiful slides and then we'll have an interactive dialogue. Over to you, sir.
Thank you. No, my screen is on. Okay, my screen is on.
Yes, you start.
Okay, thank you, Dr. Mahesh, for giving the kind words. And first of all, I would like to thank you, Heart Care Foundation and USV, as well as the IJCP. This platform was made by none other than late Dr. K.K. Agrawal. I respect him, I salute him. What he was. I wanted to dedicate this presentation to late Padam Shri Dr. K.K. Agrawal. He is such nice person. So many times he called me for this Med talk, but I could not make. Anyhow, today I have made it. So Dr. Agrawal, what he was, his dream, aims, motive, and passion were so many. What was that? To educate the people at large, at ground level, and dedicated work for the medical fraternity as well as the society, and good relation with everyone, from the public to the government or the bureaucrats, everyone. He wants to have a good relation with all the things, and update medical fraternity and people about the current affairs time to time. Even if he knows in the morning, then he wants to tell the people in the evening. By the evening, he wants to update the person, everyone, medical fraternity as well as the public. So the very important, his motto was to stop the violence against the doctor. It was his dream. Today we will try our best to continue his dream to be true, have to be true. How we can do it? We can do. If there is no violence, doctors are healthy, pharmaceutical healthy, everyone is healthy, then we can prescribe the doxycycline. Otherwise, how we can prescribe the doxycycline or treat the patient properly? So I will give some 5 to 10 minutes presentation that is dedicated to the Dr. K.K. late Dr. K.K. Agrawal. So dear friends, he was incomparable personality, unique personality. So disclaimer, this presentation is exclusively for the education, motivational purpose. There is no conflict of the interest, any intention to hurt anyone in person, fraternity, government, media, action of the organization. In fact, it is an observational and the evidence-based presentation we have done at the ground level. So what are the sources of this presentation? This presentation is based on the many discussions with the office bearer of the various medical associations to which I am associated as team IMA members and group of the senior physician who wants to restore the harmony among the public, doctor, government, bureaucrats, all among that, and to regain the lost dignity of the medical fraternity, especially of the doctors. So we had also discussion with the various departments and the public. So it is an outcome of the holistic approach, discussion, evidence, and the observation. So how can we fulfill the late Dr. K.K. Agarwal dreams? How we can pull him? Violence against the doctors becomes disease and it becomes a pandemic like the COVID-19. So there is steep rise in the violence against the doctor that made the stormy time for the healthcare system and breach in the relationship among the doctors and the people, how we can treat the patient. If there is no relation, if there is no trust, how we can treat the patient, how we can prescribe the doxycycline. So dear friends, these are stormy times. In the morning, you see this type of the news. It is very bad for the healthcare system. So dear friends, violence against the doctors almost nil or the minimal in the day-to-day clinical practice when the profession was considered as a noble and when there was no political interference in the medical treatment or the healthcare system and there was no businessman or the corporate involvement in the healthcare system. That was the golden era at that time. So no consumer protection was there. There was no violence at all. So violence against the doctor has increased in the day-to-day clinical practice. Why? Google media made the various treatment option available to the people with the advertisement or even on the online buy. I don't name the any person because they give the drug and all that without research work and all that. The company are seeing all that they are giving all the drugs without any research or the purpose. So there is a lack of the infrastructure and the modern equipment in the hospital and diseases are managed by the non-medical. Disease is managed by the nowadays non-medical. I will tell you later on. Miscreants compel the people to go against the modern medicine, but they avail it once they become the sick. As per our survey, we have surveyed. They take the modern medicine, but they become the force the people to go against the modern medicine. At the same time, people want the high-tech treatment. It is the fact. So Google and digital media has made everyone हाफ बेक ट्रीटिंग डॉक्टर स्पेशली इन इंडिया. कहते हैं ना आधा डॉक्टर हमेशा खराब होता है, ये बना दिया है. हमारी कंपनी की दवाई क्या करेगी जब ये हाफ बेक डॉक्टर अपनी दवाइयां यूज करेंगे. तो ओवर एक्सपेक्टेशन ऑफ द आउटकम ऑफ द ट्रीटमेंट इररिस्पेक्टिव द डिजीज. कैंसर हो 100% चाहिए, कोई बहुत ज्यादा सीरियस पेशेंट हो उसके लिए 100% चाहिए. दे डोंट नो द स्टेज दे गेट द एडमिटेड इन द हॉस्पिटल. दे डोंट नो. Private public partnership model of the healthcare system, it is also role in the violence. Real doctors are always soft target from the public to the government, including the media. Always real doctors are targeted. So dear friends, in spite of that so many violence, still doctors are morally duty bound and COVID warrior. A quote, what a great picture which shows how a doctor is trying to save the life of the not caring about his life. Salute to that painter with the heart. Salute to him. If we go for the mortality of the doctors in the India, all over India, in two waves, first and second wave, almost more than 1,500 doctors COVID martyr. It is very, very bad because one doctor means you have there is a great loss for the country. How we can treat the patient? A doctor means how many patients are lack of the services of that doctor. So this is the scenario of the today. So dear friends, bureaucrats and the politicians have made the doctors overloaded. Just like the picture, they all the load on the corona on the doctors. Politicians and bureaucrats are like this. This is the scenario of the today. So this time, in the first wave, this was the stay alert COVID-19 released by the doctor during the first wave. But doctors had requested to people, but no one listened to them, and that led to the second wave. If people are not still serious about this, then ready for the third wave. Dear friends, definitely third wave will come if you are not serious. So dear friends, question to all. How long the doctor suffer from the other's mistake? Accident somewhere else, patient expire in the hospital, doctors are beaten. Alcohol liver disease, liver disease due to the alcohol, patient expire in the hospital, doctors are beaten. Heart attack due to the uncontrolled diabetes mellitus, hypertension, patient expire in the hospital, doctors are beaten. Building collapse somewhere, patient expire in the hospital, doctors are beaten. Oxygen and beds are not available in the hospital, patient expire either in the hospital or in the front of the hospital, doctors are beaten. Lack of the infrastructure, patient expire in the hospital, doctors are beaten. This is a scenario. How doctor can work? How can doctor prescribe the medicine? I don't know. I will ask to everyone. So, quarrel among the public, injured it themselves, patient expire in the hospital, doctors are beaten. These are scenario. So, dear friends, violence still is on. This is the latest violence of the junior doctor. एक बच्चे को मारा, एक डॉक्टर को मारा है, क्या डॉक्टर क्या करेगा जिंदगी में? वो यंग जनरेशन, बहुत दुख होता है. 1 June 2021, Assam Tejpur. This is the violence. How a doctor can work in this environment? So, dear friends, if there is a violence, doctor, the burnout syndrome, what will happen personally? There is a broken relationship. The doctors will addict to the alcohol or the drugs. They will go into the depression. Or sometimes you have seen so many doctors are committing suicide. This is the scenario. The personal loss of the doctor. If doctor is not healthy, then how he or she can treat you? So see, about the professional service, if doctor is ill or the depression, under the depression, decrease the quality of the care and increase of the medical error. If the quality of the care decrease, definitely there will be a medical error that will be converted to the negligence. That will doctor will have to go to the court. So this is the scenario. That decrease the patient satisfaction. If patient under doctor under depression, if he is not well, then how can he satisfy the patient? This is the scenario. So
I think, sir, yeah, we will go with the discussion now. Yeah.
But एक slide हो रही sir, last slide. Only one slide. Decrease the productivity, profession efforts. This is the scenario. So dear friends, we are doctor giving the safety to the patient like this, but public giving the doctors this safety like this. So as per survey of the option patient wants, this is the treatment. Everybody wants to expert the treatment from the high-tech treatment, either free of the cost or the charitable. And with the government or the Neta or trustee, it is not possible. So ultimately lead to the doctor Lutere. So I request to the public, don't assault the doctor. It is for you. Don't assault the doctor. Then over to Dr. Mahesh. Sorry for taking the time.
Yeah, thank you. I think this is a very healthy discussion on the role of the doctor and patient.
Dr. Mahesh, ऐसा है कि जब तक violence कम नहीं होगा, तो we cannot treat the patient properly.
Right. So I think fever, this COVID, sir, COVID, I think 19 as an important fever has really taught us that.
Yes. Now Najib stop. Sorry for that.
Yeah.
Sorry for that.
So in the practice, sir, fever is a puzzle. I think still India has a hub of infectious disease. So how do you think that fever as a puzzle in Indian practice, in your own practice?
Yeah. India?
Yeah, what are the different common causes in the clinical practice? Because fever is one of the very common condition in all medical practices. Yeah.
Dr. Mahesh, fever is a no diagnosis. It is only the symptom. Fever. 1,000 causes of the fever are there. We have to. For the physician, fever is the only thing which is difficult to treat. Yeah. If there is any boil, fever is there. If there is cancer, fever is there. If TB, fever is there. Viral fever, bacterial fever, protozoal fever, anything can cause the fever. Fever due to any cause. We have to decide, we have to diagnose the fever, then we can treat. Unless until you diagnose the fever, you cannot treat the fever. Fever is very difficult to diagnose.
Yeah, when the sugar is elevated, commonest cause is diabetes. But when there is a fever, I think
not due to sugar, but if there is complication due to the sugar, if there is a diabetic foot or any infection, then it's the fever.
Yeah. So I think one of the very important causes of fever is bacterial infection, and doxycycline is one of the very important antibiotics. So it's a broad spectrum. And how do you feel that doxycycline has a broad spectrum antibiotic?
Dr. Mahesh, doxycycline is the only drug. It is a time-tested and very economic drug. It has been used since many years. So it is a broad spectrum. When we were the intern, at that time, we start with the broad spectrum antibiotic. We send the sample for the culture and all that. Unless until the report comes, we start the broad spectrum. The doxycycline was the first line of the drug to treat.
Yeah. So I think it is for more than 6 decades. It is there in the practice. But what is the interesting point, sir? Actually, is that today we are thinking about bacterial resistance, whether it is a macrolide or cephalosporins, penicillins. But what is unique that we don't find so much of resistance with doxycycline. So what do you feel in the
Yeah.
practice also? Yeah.
First, the resistance develop if you are using injudicially or any drug. The people are using the cephalosporin, azithromycin, just like a toffee. So that will lead to the resistance. Number of the doctors are not using the doxycycline, so the resistance is very, very less. That is the only cause. Resistance is very, very less with the doxycycline because people are not using.
Yeah. So I think selectively used doxycycline in various infections. So that is a very important point as you are mentioning. And the important different modes of action. The mode of action is doxycycline is slightly different from the other classes, and that also makes it a versatile kind of a antibiotic. So, but today's our topic is going to revolve around other diseases. I think one of the very important diseases in India is also hub of malaria, and there are so many zones in India which have got a high peak of malaria, and during the monsoon season again it becomes the number of cases becomes 5 times, 10 times. So is there any role of malaria and the role of doxycycline? Because there are classes of antibiotics which are used, artemisinin, quinine,
Yes.
chloroquine.
FDA,
FDA,
FDA US has approved only the doxycycline against the malaria. When any travel go to the malaria, they start even with the chemotherapy, chemoprophylaxis with the doxycycline. It is the only drug which is approved for the chemoprophylaxis of the malaria. And even it can be used for the treatment of malaria with the chloroquine. We can give the doxycycline with the chloroquine because it is also anti-protocol. It will be used.
Yeah, so I think one of the point is very important is chemoprophylaxis. So which are the category of people normally the chemoprophylaxis is given? Yeah.
When they are traveling to the malarial endemic or the pandemic area, then they will start the chemoprophylaxis with the doxycycline. We start with the 100 milligram BD for 2 days, then we start with the 100 milligram till he remain over there. And it should continue after the 4 weeks after coming to the malarious area. It should continue.
Yeah, I think it is very, very important because now currently in the COVID, the traveling is less. But normally in our every year, the people travel to various places because of business purpose or because of our office, or even there are troops, police troops or CRPF troops. They move from one place to another.
Savior, or the rescue team.
Rescue teams, absolutely right. So
They
all
are
these categories. Yeah, they require chemoprophylaxis. And in the treatment part also, is there any role of doxycycline treatment?
Yes, they give along with the chloroquine, you can give the doxycycline for the treatment of the malaria.
Yeah. And there are some points also mentioned about like when the patient is admitted and we give artesunate injections or quinine injections. Now at that time also there is an addition of doxycycline, especially some of the guidelines.
If you give the steroid, the immunity will be decrease, then there will be a chance of the infection. Sometimes they give the doxycycline to treat the super added infection.
Yeah. So I think absolutely right. The malaria is also present with infections like respiratory tract infections, and superadded infections are common. Even the urinary tract infections also.
At that time, malaria is not common because malaria is due to the mosquito bite.
Yeah.
Not to the infection. If there is a superadded infection, then we can use it.
Absolutely right. And in the if you see in the malaria, the OPD treatment is artemisinin-based combination therapies.
Yeah.
But in the admitted patient, what happens? This is isolated, that either intravenous artesunate or intravenous quinine. So
then you can add the doxycycline, but then you can add the doxycycline.
Yeah. So there, I think one can definitely go on.
It is a personal choice of the individual choice.
Yeah. The another important indication we are talking about, so I think, is dengue fever, which is another mosquito-borne, and I think thrombocytopenia in your practice. Yeah. So
definitely, it is an immunomodulator, and it will also act on the cytokinins, anti-inflammatory. That's why they are using in the dengue fever. Dengue fever is the 4th variety. Dengue virus 1, 2, 3, 4. There are so many varieties that causes the hemorrhagic fever, dengue fever. So it is if, being a immunomodulator, then it will be used in the dengue fever. It is very useful in the dengue fever, doxycycline.
Yeah, I think apart from doxycycline, what are the different other options you give in the dengue? Any precautions you want to tell to the physicians as well as the viewers which are attending during dengue fever?
Dengue fever, I couldn't know what you say.
Any precautions or any
Because
specific
it
treatment
should
you want
not
to
be given to
advise?
the pregnant woman, lactating woman, and less than the children less than 8 years. These are the precautions. Doxycycline should not be given.
And what is the pattern of thrombocytopenia in dengue? It is not related to doxycycline, but thrombocytopenia, what is observed in dengue patients?
There's a hemorrhagic fever. There's a chances that dick, and there may be a thrombosis. Then that will lead to the platelet aggregation. That will reduce by the anti-inflammatory effect of the doxycycline.
So I think you are
Both
telling
will
that
work. That
inflammatory,
will act on the
anti-inflammatory effect is
cytokinin,
good.
TNF. There's a TNF tumor necrotic factor.
Necrosis
Yeah,
factor.
that is cytokinin, anti-inflammatory.
Yeah,
So
so as you have
doxycycline,
mentioned, yeah, febrile illness is always having the inflammation in along with them. So anti-inflammatory action of doxycycline will be very critical. In the
Dr. Meher,
practice, how,
this is the in the fabric illness. If you start with the doxycycline, it is a very safe drug. It is a broad spectrum. If there is another type of the just other cause of the fever, then it will act because it is broad spectrum. Unless until you get the diagnosis by the serological examination or the smear examination or the rapid test examination, till then you can start the doxycycline till the results come. Once the result comes, then you can give the specific antibiotic. Or most probably, most of the time, doxycycline is the sensitive to all the bacteria.
yeah. So I think we have discussed. I think viewers, we are discussing about the role of doxycycline. Dr. Chabra has rightly mentioned that the doxycycline has got a role as an anti-malarial agent, along with artesunine as well as quinine. And also, doctor was emphasizing upon the point in chemoprophylaxis when somebody is traveling to the endemic areas, and there are known endemic areas in India where the malaria is very predominant, and even nowadays in India, falciparum malaria is higher as compared to vivax in certain places.
Yeah, yeah.
Yeah,
You
and
can
doctor
use
is
the
also
falciparum
practicing
also.
in
With the primaquine, you can use the doxycycline also in the falciparum malaria. Or the ovale variety, you can use it.
yeah. And now the third disease I want to open up a discussion upon is leptospirosis.
Yeah.
So yeah, so what is the role of doxycycline in leptospirosis?
Leptospirosis very good role in the bacterial infection. If there is a mild case of the leptospirosis, doxycycline is the only thing which you can use. If there is severe case, then you other drugs like the penicillin and all that. But then leptospirosis is very common in the agriculture area. On the it comes from the urine of the mice. Uh, I have seen so many cases in the storeroom. There is a can of the coke and all that. There is a urine contamination with that can in the urine. If you don't wash that cane and you take the poultry from that cane, then definitely there is a chance of the leptospirosis. Then if there is a fever, then you can start the doxycycline. In the rural area, we don't have the facility of the lab facility on that. Then you can start because there is a mixed infection. Any other bacterial infection, then you start the doxycycline. That will the spirometron as well as other infection. The doxycycline will be better in the rural area especially.
Yeah. So I think you are emphasizing that in rural areas where the diagnostic facilities are not to their up to mark.
Yeah,
So
yes.
it's better to don't wait, just start on doxycycline, considering the leptospirosis infection as one of the possibility. And in mild cases of leptospirosis, especially in the urban settings, also we are using, and in the severe setting, you can use as an add-on drug. Definitely,
Yeah,
no doubt about that.
we
So
have to
we
add
have discussed.
the antibiotic.
Yeah, we are discussing about one of the very important point as you have raised is that the fever, and in the fever also because of the febrileness, whether it is a viral, bacterial, or malarial, the inflammation process is triggered.
Yeah.
And I think there are very few antibiotics which are like azithromycin is might be one, and other is I think doxycycline have got anti-inflammatory action. So, what is your opinion? Evidence you are emphasizing. What is the evidence of doxycycline as an anti-inflammatory?
Definitely it acts on the cytokines. It is anti-inflammatory drugs, immunomodulator. So that definitely it will do a role in the anti-inflammatory on
Yeah.
all cytokines, interleukin, TNF or CNTF. All the cytokines are affected by this doxycycline.
What are the normal dosage patterns in your practice, doxycycline?
We start with the 100 milligram BD or the 200 milligram OD. Basically, usually we use the 100 milligram BD in our practice. I think most of the doctors are using 100 milligram BD or 70. Then it may extend. It can be given for the long time because there is a side effect are very less with the doxycycline. It can be
Yeah, I
given for
think
long term.
one of the point you have raised is that in terms of side effect, because with amoxicillin we see diarrhea, but I think doxycycline even for long term it is suitable.
Sometimes it can be given in the diarrhea. If there is viral diarrhea, it will definitely work. So many bacterial diarrhea, it will work. So doxycycline can be given. The diarrhea is very uncommon in the. There may be a diarrhea, but uncommon. It is uncommon with the doxycycline. If you give the lactobacilli and all that, then that will be better with the doxycycline.
I think this is one of the very relevant point you have put forward is that the whenever there is any febrile condition, obviously the GI upset happens, and apart from that, if the antibiotic is given, that also leads to GI upset. But
Yeah,
doxycycline is devoid of this, right? So it
yeah.
is yeah, it has got an anti-inflammatory
It
property,
does
and
do.
even GI tolerability is relatively better in the practice.
Yeah, it is GI friendly drug.
Yeah,
GI
it's a
friendly drug.
GI.
Dr. Mahesh, what we
Yes.
require? We require the well tested drug, economy is there, simple, broad spectrum, and easily available. So these are the things we require in a drug that it meets all the things in the doxycycline.
I think this is a very great message you have talked about is that when you select an antibiotic, what exactly is required. So I think all the viewers very nice points Dr. Chabra has come out with is that the antibiotic having a broad spectrum, ease of use, the cost is not so hindrance for selection, the availability of the drug, the relatively less resistance, and the versatility. Doctor
The
also emphasizes food.
cost is very important in the India because we are in the India. India cost concern is very important because most of the people are not tolerating the cost. So cost and availability both.
Yeah, I think this is very relevant fact is that the cost is very important for selection of any drug, including the antibiotic.
Yeah, yeah.
And in the COVID scenario, I think we are seeing that the cost is going to be a more and more important factor because the economical setback which is there among the people. So whenever there is
Doxycycline
any
has
effective
been given left and right given the in the COVID era with the
yeah,
azithromycin. Every people are given the doxycycline. In the first wave, there was the doxycycline given too much good doxycycline. It was short in the market. Doxycycline.
again, I think the point which you have emphasized is that anti-inflammatory action, right?
Yeah.
So the inflammation curbing in the early stage that reduce the cytokine storm. So doctors definitely have found out that doxycycline is very suitable for countering the inflammation even in the COVID scenario. So I think
Contraindication
very
only. Ji?
yeah, you are also I
Contraindication in
think
the pregnancy, pregnant woman, lactating mother, and the person less than 8 years. These are contraindication for the use of the doxycycline. One we should not
yeah I
use.
think we should not use in those specific conditions which Dr. Chabra has rightly mentioned.
Or one thing I want to tell you, it is not binding with the calcium. So there is no tanning of the your teeth and all that. There is no binding with the calcium. That is the beside the in the tetracycline there is a tanning of the your teeth, but with the doxycycline there is no, because it doesn't bind with the calcium.
Yeah, I think tetracyclines long back, because of their one of the side effects, they were abandoned, and the
Yeah,
newer molecules with better tolerability came. But I think doxycycline doesn't have got the side effect which discoloration of teeth, which is the property of older tetracycline. So they were been abandoned at that particular period of time.
yeah, tetracycline is abundant.
So I think this is a very good dialogue discussion, a healthy discussion. The doctor started with one of the very important message, and that is doctor and patient's relationship, which has created
उसके लिए
slightly
मैं टाइम आपका ले लिया 10 मिनट, सॉरी फॉर दैट.
नहीं नहीं
That was
that's a
it needed. That was the needed message.
I think Dr. K.K. Agrawal's one of the message was propelling medical science, propelling a good healthy relationship between patient as well as
Me,
doctor.
I
So you
talked
have
to him.
rightly pointed out this point, and then we have gone to the whole doxycycline discussion. And
Yeah,
the doctor has rightly talked about, emphasized that it can be used in malaria,
yeah,
chemoprophylaxis as well as treatment. It can be used as in the dengue fever because of the anti-inflammatory action, and it is straightforward action against leptospirosis, whether it is a mild case as well as moderate case. So I think thank you very much, doctor. I think this dialogue has really helped. It will go to the message will go to a lot of doctors, healthcare workers attending this particular program, including the patients. So I really thank Dr. Chabra for his interaction during today's program. Also, it is a great Dr. K.K. Agrawal's Med Talk show. It always gives a great scientific data diffusion across the globe in collaboration with ICCF, Art Care Foundation of India, and obviously USP. So it is very important in the today's time that the health of everybody is important. So सर्वे भी सुखिनः सन्तु, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखमाप्नुयात्.
क्या बात है. मैं जी, आप तो इसमें भी माहिर है. श्लोक में भी है.